UBC, inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, ladies and gentlemen, esteemed viewers, our fellow seekers of enlightenment. We welcome you to yet another episode of the DOCtalk show, produced by Quiz Mali Productions and brought to you or sponsored by the Ministry of Health of Uganda and its partners. I am Dr. Muyanja Andrew Muyanja, your host tonight on the journey into the world of medicine. And tonight, we are exploring the topic of eye infections. The eye, a radiant window to the soul, sparkles with the depths of oceans and the warmth of sunlight, silently revealing untold emotions and stories with every glance, a timeless mirror of the heart's whispers and the mind's dreams. I hope you have received that poem. Tonight in the house is a team of content experts from the Ministry of Health and from Mulago National Referral Hospital, Dr. Alex Wasomoka and Dr. Grace Ssali. You are welcome to the DOCtalk show.
Thank you very much.
I will request that we start with simple introductions from the far left, coming this side.
Thank you for hosting us at this DOCtalk show of today. I'm Dr. Alex Wasomoka and I work at the Ministry of Health as Assistant Commissioner in charge of hospitals and lower level health facilities. And by training, I'm an eye doctor, an ophthalmologist. Thank you.
You're welcome.
Yes, doctor went for greener pastures. I am Dr. Ssali Grace and Severa. I work as an eye specialist, what we call ophthalmologist in the Mulago National Referral Hospital, super specialized hospital. And I work as a pediatric ophthalmology. What those words mean is I'm an eye specialist who is more inclined to treat children's eye problems.
Dr. Wasomoka and Dr. Ssali, we are honored to have you here. And from the introductions we have received, I believe we are not going to leave this place the same. The topic tonight is eye infections. We have often interacted with people and we hear people talking about how important the heart is, how important a kidney is, how important the brain is. But tonight we need to appreciate the importance of this organ on our bodies, which occupies 0.75% approximately of our total body surface area. Dr. Wasomoka, what do you think, from your perspective, is the importance of the eye in the grand scheme of things?
Thank you very much, presenter. Now, actually, you have described most of it in your poem, the opening remarks. It is actually the eye which actually opens us to the world. It's through the eye, because for it captures the images, sends to the brain, and the brain interprets what we see. So, if it wasn't for the eye, then we would not be able to know what is surrounding us or even what we do. Because of the eye, the rest are. Yes, because everything we do depends on sight. And much as the world has tried to put up affirmative action for people with disabilities, what to do whatever they do. Yes, they have put up even some other kind of slogans that disability is not inability. My friend, when you have if your sight is not okay, a lot you will not be able to do.
You're missing a lot.
A lot. Because just an example, when UPDF is recruiting people, they can't recruit someone who can't see.
True.
Even you, when you fall sick and you go to the hospital, you will not feel comfortable if the doctor is not able to see. Look at whether you go to the bank, it is still the same. The teller or whoever, the accountant, the manager there must be able to see. So whatever we are doing, we must have good sight. So those are some of the few things I can mention, but there are just too many, countless.
Interesting. You spoke something, and I wanted to ask you whether at one point you did poetry as you were coming up. But in essence, what I pick from you is for us to fully appreciate life around us. We need all the senses that God gifted us. That is, we need the sense of touch, we need to hear, we need to taste, we need to smell, we need to see. So, basing on the topic tonight of eye infections, we would like to start from a point of understanding what, Dr. Grace, from what you know, are the common types of eye infections we encounter within our context.
Eye infections narrows us a bit because there are very many things that can happen to the eye because it's exposed. And because of its exposure, we can have so many things like trauma. It can dry up. If you're unconscious and the eye dries up, then that can cause a problem. But let's stick to the infections. Recently, I think this whole year, since January, we've had what we call the red eye epidemic. And mainly that was an infection, because it was, if your neighbor has it, you can easily get it because of what you're touching and then touching your eyes. So that infection is actually, because we haven't really, we still have the epidemic with us. That infection is a viral infection. And we've done so many lab work, so much lab work to find out the real cause, the real bug that's causing the infection. And in addition to the viral infections, we can have bacteria, we can have fungal, we can have what we call secondary infections due to maybe trauma to the epithelium of that outer covering of the eye. Infections of the eye are very delicate, should I say, because most people don't know what to do with the eye infections. What happens is they do what comes to them first, what we call home remedies, and they'll put all kinds of concoctions, vegetative material, they'll boil tea leaves, they'll boil any kind of leaves, which have some names in Luganda that I don't know how to call in English. They put urine, actually. So with this red eye epidemic, we found, actually now we are seeing the problems of the infections that happened that are happening during the red eye epidemic because of the home remedies, and that includes putting urine on the eyes. So now what we are having in the hospitals is a lot of what we call it perforations, whereby the front of the eye gets torn or
It's actually eaten up.
Or eaten up or melted up.
And
yes.
perforates.
And melts up and perforates because of everything they put on the eye. And that causes blindness. So when you talk about infections, for us we get worried because it can cause blindness due to everything else that the public does without coming to the hospitals.
You know, Dr. Grace, you were talking about the different homemade remedies we use. And you talked about one which I believe some viewers out there will think is a joke, but we are going to share some pictures of people who have used urine and what has happened thereafter. It is shocking. It's not a joke. It is reality. Some of our fellow citizens are using urine to manage eye infections. But allow us to have a short commercial break and we shall be right back.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break, and this is the DOCtalk show. The topic of discussion tonight is eye infections. We are streaming live on YouTube, but you can also send in any questions you may be having via the phone number displayed on the screen or via our Twitter handle as well. We left off when Dr. Grace had spoken about something which sounded shocking. That is that people actually out there are using urine to treat eye infections. And during the break, we had Dr. Alex Wasomoka giving us a few insights, which I believe the public out there needs to actually understand about the use of urine and the dangers it poses to us.
Urine is something which is commonly used by people out there when they think they have eye problems. But let me caution them. Use of urine is very, very dangerous in the eyes because the urine itself, it's not only a waste product from the body, but sometimes it carries very dangerous bacteria which can affect the eyes. And these bacteria, once they enter the eye, they can easily perforate the cornea. That's the black part of the eye, that black spot. And that black spot is the window where light enters into the eye. So once it is damaged, it means the entire eye is gone. So I want to caution people out there, our viewers, and such that they don't get into this mess. They don't cause problems to themselves or their dear ones by applying urine into the eyes. Also, even use of herbal medicines, they contain some fungi which are very dangerous when they get into the eye, and they are very difficult to treat. So even then, those leaves may contain other chemicals, some which can be corrosive to the eye tissues. So let us not risk. Actually, whenever you have an eye problem, I just advise you to go and see an eye doctor. Go to a hospital or a health facility where you can get treated by an eye specialist there.
Oh, thank you so much, Dr. Wasomoka. Let he who has ears listen. Maybe what Dr. Wasomoka didn't tell us is that when HIV came, many of us think that gonorrhea disappeared. But gonorrhea is out there. And if by any chance you urinate and you have gonorrhea, certainly if you use that urine on your eyes, you will have transferred the gonorrhea to the eyes. and it will wreak havoc as much as it wants. So let us take note of that.
So when you're out there and you get an eye infection, usually one of the first things you feel in the eye is irritation, as if something has fallen in the eye. You get irritation, there's something we call foreign body sensation, as if sandy, then later it may become red, then later you'll have a discharge. Discharge in Luganda we call ebinyinyi, whitish. In the morning you'll find that the eyelashes are matted together, and you may keep cleaning but it comes back.
By matted you mean they are stuck
together.
Okay.
And the eye is red, it's tearing, it's painful. At times we even find a wound, what we call an ulcer, on the eye.
There's sometimes also that hypersensitivity to light.
Yeah.
Fear of light.
The fear of light.
Yeah, you don't want to look.
Photophobia, you look in light, it tears, it's painful. So at times, most of the time they come in with those kind of problems. And what usually happens, they go to non-eye specialists, and the first thing they put their hands on is a steroid, is a steroid eye drop. So what happens, usually by the time people come in hospital, they've failed to do everything else. They've tried the tea leaves, the salt. And
I'll request you not to rush that steroid point, because it's a real problem out there.
It's a real problem out there. So when they come in, usually they don't come to us first. They do what they do. They put salt, tea leaves, the urine. Most of the time, the infection is self-limiting. With or without treatment, it comes and it clears. But sometimes it doesn't. And after doing all that, you come into the hospital, and the ulcer or the wound is so bad and very difficult to treat, especially when you've used so many other things before coming to the hospital. So usually we find that let me go to the children, because I love the babies. When a child is born, they pass through the birth canal, which is usually not very clean, and they're born with infection in the eye, and it can be anything. It can be bacterial, viral, and it could be gonococ also. So when that child is born and we do nothing, those eyes can still perforate, and the child grows up blind. But now we teach the midwives to manage whatever they can manage. As soon as the child is born, we give something, usually tetracycline eye ointment. So every child that is born is given tetracycline eye ointment. So we don't see as much of the children coming in with perforations and blindness due to that, because now every midwife knows that a child born should have something on the eyes to prevent problems due to the birth canal that's not very clean.
We like those drugs a lot, but Dr. Grace, maybe, and Dr. Wasomoka will explain to us, or should explain to us actually, what can go wrong in case you go out there, you have issues with your eyes, and you just rush and put this DEXA. Moreover, you even put it for duration, which still a doctor would not tell you, even if he was to tell you, okay, you use DEXA. He would not tell you to use it for 2 months or 3 months or 4 months.
Those drugs you've mentioned, dexamethasone or probeta, they fall into that category of steroids. What it does, it has another very serious complication that it may cause, and usually it is it alters the drainage of the aqueous. That's the eye, which is in the fluid in the anterior chamber of the eye, and the pressure builds up in the eye, and once the pressure builds up, the eye destroys the optic nerve. That is the nerve joining the eye to the brain, and therefore, and that it is actually a slow process. So that disease is called glaucoma. So it causes those steroids in the eyes, if used for a very long time, they predispose the patients to glaucoma, which is a blinding disease. And glaucoma causes permanent blindness. So, still, I go back to my point that don't do self-medication. Always seek treatment from a qualified health worker. Go to any health facility where there is an eye doctor to treat you. Because the eye is so delicate. And once you lose it, there is no hope of getting.
There is no spare.
There is no spare. We have only one life to live.
I don't know if we have eye transplants. You are the expert. I will ask you later about that. But let us have a short commercial break and we shall be right back.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break, and this is the DOCtalk show. Our topic of discussion this evening is eye infections. We left off on a point where Dr. Grace and Dr. Wasomoka warned us that the eye has no spares. If you lose the eye, unlike the heart where you can get a transplant or the liver or the kidney, you won't have a spare. So take charge. We are continuing off on a point of us wanting to know that, yes, I have got all these symptoms you talked about. You talked about the irritation in the eyes, possibly the reddening. You talked about an abnormal discharge and a number of other symptoms. But you as a specialist, how would you arrive at a diagnosis of what particular eye disease I may be having?
Usually what you see guides you a lot on the diagnosis, especially if you've seen many. The type of discharge may guide you on what kind of infection you have. The history, if you come and tell me I was in the garden digging, something hit my eye, and I'm seeing something in the eye that's typical of a fungal infection, already I know it's fungal. If I look, even before I look through my machines, but I am seeing something, the ulcer on the eye looking a certain way, like a tree branch, already I know it's viral. If you have, say, herpes zoster, and I see something on the eye, already I know this could be viral. So usually what you see and the history already tells you, and experience already tells you that most likely it's this. So when we do whatever we do to take things to the lab, like the discharge or whatever is coming out of the eye, we call it a swab, take it to the lab, it is just to confirm what we think. Lately, patients come into hospital after they've used a lot of medicine, that even when you go to the lab, they will tell you, we don't see any organisms, and yet the disease is still going on. But because they've come in with a lot of concoctions of antibiotics and all other traditional things we've talked about. So your clinical acumen helps you a lot to make a diagnosis and to start treatment, because every hour with an infection in the eye, every hour is a problem. So most of the times we can't reverse. If you get an infection on the eye, even when it heals, you'll get a scar, and we cannot remove that scar.
Interesting. From my interaction with you, Dr. Wasomoka, I believe you have practiced medicine for over 20 years. Now, I don't know for how long you've been an ophthalmologist, but it should be some good time. How, if you have arrived at the diagnosis, how do you treat us usually?
We have different approaches, yes? Depending on what the patient has actually presented with. But we normally have what we call a medical approach, whereby we can only treat using drugs, and also if it requires surgical interventions, we can also treat surgically. But there are times when actually the treatment may not necessarily be surgical or medical, but it requires just teaching the patient what to do. And that health talk, if you give the directions that you should do A, B, C, D, you shouldn't do this one, 2, 3, and the disease cures. Because some diseases cannot be treated surgically, neither medically, but just giving guidelines on how to live, and everything is sorted. Lifestyle, yes.
Hand washing.
Okay. And I think we can state those lifestyle changes, the common ones we usually give, if possible. So we have talked about hand washing.
With soap and water.
With soap and
With
yes,
soap and
yes.
water. In hospitals, we use a lot of sanitizers.
Yes. What of the practice of cleaning our eyes, actually, the morning?
We usually...
Not with soap this time.
Yeah, we usually ask you to wash your face normally. Don't pour soap and water in the eyes.
Yeah.
The tear is a normal cleanser of the eye. So in Busoga, we have a lot of eye infections, and at times we think it's maybe lack of clean water or something like that. So there's something we call trachoma, and it's mainly an infection on the eye that's transmitted with flies and house. Yeah. So even just proper disposal of feces, just washing your hands, all that teaching can help to prevent eye infection.
Actually, to add on what Dr. Grace has said in Busoga, because I've worked there, I'm born there.
And you're born there.
Yeah. So people did not suffer from trachoma because they didn't have safe water. But it was just a way of living.
Yes.
Now that they have been educated a lot about the disease, actually, currently what is in Busoga, they are just treating the remnants, all those complications of trachoma, those long-term complications.
Yeah.
For those people who lived during those days when the infection was still active. But currently, the years I worked in Busoga for over 12 years, I worked in the Jinja Hospital. I never saw any active case of trachoma. So we are just dealing with those long-term complications only. So the new active cases are now in Karamoja. That's where the problem is so much.
Still active.
Certainly, we thank you for that testimony about the fact that Busoga, rather trachoma, is now talked about from a historical perspective within Busoga region. What kind of complications does the public out there need to know which can happen in case they experience eye infections and maybe are so relaxed about managing them?
Something we've barely talked about is trauma. You can get trauma, which is what we call penetrating trauma, with something, usually it's the children, a stick that had some bacteria on it and causes infection inside the eye that we call endophthalmitis, which means it's not only on the surface, but all the tissues in the eye are full of that bug. And the eye will get a pocket of pus, you know, and very, very difficult to treat. Usually those eyes, if you come in late, you lose the eye. We just remove that eye. So if that doesn't happen,
So
and then
complication number one, the worst case scenario,
you lose the eye.
I can lose the eye.
You lose the eye, yes. So that can even happen after surgery. In case a bug enters that eye, and you get what we call endophthalmitis, you can easily lose that eye. But if it doesn't go behind the eye and remains on the surface, and it heals, and you're lucky that it heals, you remain with a scar. So that scar, problem with it, it cannot go away. Like any other scar on any other part of the body, scar tissue does not go away. And we may have to transplant another cornea on the surface of your eye. That is very expensive. It costs about 10 million right now, and most of our people cannot.
A corneal transplant within Uganda costs
About 10 million.
About 10 million
Of course,
shillings.
most of our people cannot afford that.
Dr. Grace, I think we need to go and have a break, take some water, and we recover from what you have just told us. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show, and we are discussing about eye infections. You can send in your questions via our YouTube channel, via our Twitter page, and certainly you can send them in via the number that is displayed on the screen. We left off on a point of shock mixed with caution, that if you have corneal, scarring as a result of, as a complication of eye infections, and you need a corneal transplant, it can actually cost you 10 million Ugandan shillings. And it is not a must that if you have 10 million Ugandan shillings, you'll even get that corneal transplant. So let us be watchful. Whenever we have eye infections, let us seek help as early as possible. Dr. Wasomoka, Dr. Grace had given us a number of complications. I wonder if you have a few more to share with the public.
Yes, there are other complications which are not, she had not mentioned, but there are a few. And among those, we have what we call cataracts. That is the clouding of that lens, that natural lens in the eye. It becomes opaque and stops allowing light to pass through it. So once that one happens, you become blind. And the good thing about that,
Dr. Wasomoka, would you mind explaining to my grandfather what a cataract is for him to understand in very simple terms?
A cataract, as I've told you, that it is a clouding of that natural lens in the eye. In Uganda, it's called ensenke. Across the Nile, the other side, east of the Nile, because I'm told this is west of the Nile, this is west Nile as well. Okay. East of the Nile, at the source, we call it Ndezi, Mulusoga. So, ensenke, the good thing is that it is treatable, it can be operated, and you regain your sight. But still, if the infection has been so severe and it has affected other parts of the eye, there is some inflammation which takes place around called uveitis. That one makes the other cataract complicated and inoperable. So if you get that one as well, uveitis is another complication. It makes it brings in more complications that the eye cannot be operated, and you get a permanent blindness. So that is one of the problems of the infection. Some infections can affect actually the retina. That is the back of the eye. And once the retina is affected, because that is where the images from outside fall, where they are made, they are focused such that you can be able to see. So once those parts of the eye are affected by those infections, deeper infections in the eye, it can also cause more trouble. Because that one, still the blindness that it causes is permanent.
So Dr. Wasomoka, is it possible that if I have an endophthalmitis, that actually this infection can move retrogradely along the retinal nerve and maybe end up in the brain? Is that possibility?
We have a barrier, a blood. We have a barrier there. It doesn't walk straight to the brain, but there are certain things like cellulitis. An orbitocellulitis can go to the cavernous sinus and even cause death. That can happen. But we don't get infection maybe on the cornea going to the brain, or and the vitreous going to the brain. We have that. God naturally made those barriers and preventions naturally. That
so happen. It ends in the eye.
It ends in the eye.
Wonderful. So we have heard about blindness, we have heard about scarring and all these other complications. And we need to know that they may come with financial implications, but they may also cost you your sight. There is no spare part for your eye. So it brings us to one of the most important parts of this session, because we believe that prevention has always been cheaper and better than cure. How, Dr. Grace, starting from you, can we prevent eye infections from happening?
Thank you very much. Even when the child is still in the womb, when a child is still in the womb, a mother should do proper antenatal care, because certain diseases in the womb can cause infection, one in the child, but also as the child is being born, cause infections on the eye. So if a mother went and did her proper antenatal care, they treated the gonococcus, they treated the herpes, that will prevent a lot of problems as the child is being born. Now, when the child is born, still, mothers are told to put breast milk on the eyes, because that first 1 month, we have what we call neonatal ophthalmia, which clears on its own, actually. But usually they put breast milk, they put urine again, and that would cause us. So please don't. Breast milk, on the eye, yes. And urine also. That is new to me. And these things have lysozymes. They have, I'm told they work, but we don't really tell people to do that because we don't know what else could happen. So one, proper antenatal care. Two, proper, actually exclusive breastfeeding prevents a lot of builds immunity, prevents a lot of infections. Use that tetracycline eye ointment that the midwives give you, because it will kill off a few bugs. Don't put urine, don't put breast milk. And then when you're weaning the child, the proper feeding still, the vitamin A, the proper immunization, all these preventing measles, because measles on the eye, all these are problems which we can prevent when we do the right things that we are told as we bring the child up. Because if you immunize a child against measles and do your vitamin A supplementation, it may prevent a lot of problems on the eyes.
Interesting. Dr. Grace is an ophthalmologist who gave her heart to children. And so it is not a surprise that she has majored on prevention strategies within children. But we are lucky enough that we have someone from the Ministry of Health who I believe will do justice on the side of adults as well. So Dr. Wasomoka, what can we possibly do?
One important thing is the hygiene bit of it. It is so crucial. Prevention of transmission of infection by keeping our hands clean. Hand hygiene. We must always wash our hands with soap, water and soap, and make sure that even the faces, we keep our faces clean, face washing. Because that is the hallmark of prevention of infection. Once you keep your face very clean, your hands clean, then transmission of infection from finger to the eye is interrupted. And once that happens, you will get very few infections will cross to your eye. But we should not forget, because as me from the ministry, we always promote immunization. So once your child is fully immunized, there are certain infections that will not affect your child, which can be stopped, like now measles, it affects the eyes. TB can affect the eyes, and others that are within that package of immunizable diseases. So let us also make sure that we immunize our children very well. And we should not, another method of preventing infection is to ensure that whatever happens to our bodies, our eyes, let us not use herbal medicines or any other alternative medicines. We should always go to the hospital where we can get experts to treat us. Actually, those are the main ways we can prevent infections in our eyes.
Dr. Alex Wasomoka and Dr. Grace Ssali, we thank you so much for having spared time to come and share your hard-earned knowledge with the public out there. We are maintaining a mantra of prevention is better than cure. So we are emphasizing personal hygiene, and we are also emphasizing that there is need for you to keep even your environment as clean as possible. Remain enthusiastic about your health and always tune in with us every Thursday at 9 p.m. I am Dr. Muyanja Andrew Mark, and this has been the DOCtalk Show.
This message is from the Ministry of Health with support from partners.